welcome to the Learn How NHS Greater Manchester CSU implemented ServiceNow with partners in IT. This webinar is being recorded today, and if you'd like to ask a question, please type it into the question and answer tab.
Good morning, everyone. My name is Berwyn Jones from ServiceNow, and I work within our UK public sector and higher education customers. Last week, you will have heard quite a lot of exciting news from our Knowledge 14 conference held out in San Francisco. And what we wanted to do today was to bring things back closer to home. So this morning, we're going to hear from Tony Williams, the Head of Service Management at the NHS Greater Manchester CSU. Tony is going to talk about the journey undertaken by them and how their implementation of ServiceNow has allowed them to consolidate 9 different organizations into their single structure. He will also talk about the benefits that the organization have attained by implementing ServiceNow. In terms of ServiceNow, we've got over 50 UK public sector and not-for-profit organizations as customers, and around about a half of them are in the NHS sector. The Manchester project, which we're going to talk about today and which Tony is going to present about, was actually implemented by Partners in IT. They're one of our longest standing partners in the UK. They're accredited to a preferred partner status, and Greater Manchester are one of over 100 customers that Partners in IT have implemented ServiceNow at. So without further ado, I would like to hand you over to Tony Williams, who will take us through the presentation this morning. Thank you, Tony.
Thanks, Berwyn. Hello, everybody. Welcome. Good morning. I'd just first of all thank you all for joining. I hope you find it interesting and insightful. We're going to be doing some polls throughout the presentation, so feel free to contribute as and when you wish whilst I'm going through the presentation. So the presentation itself is on merging Greater Manchester. So essentially, that's about how we actually formed a single shared service from several different separate organisations, with a focus around the IT service desk and also around ServiceNow itself as a tool for which we use to underpin and support how that was all brought together. So essentially, the reasons why I was asked to present today was essentially these benefits you can see here that we managed to achieve from the project that we actually were successful implementing. I wanted to sort of share some of the insights with yourselves and also a little bit of the information as to how it can be done. Probably worth noting, there wasn't a big project team we had. It was conducted by the vast majority of operational staff as operational resource, and we had a contractor helping within the project as an additional resource to what we had. You can see here, within the 10 months of the duration of the project, we managed to go from 10 completely separate, physically located service desks to a single Greater Manchester service desk within 3 teams within that. We had a significant staff reduction from 36 to 16 whole-time equivalents, and obviously, from that, we had a significant pay revenue cost reduction. Our first-time fixed rates actually increased significantly, and also we managed to improve our customer satisfaction levels. So, in terms of an overview for the session, I wanted to just give you a bit of an agenda and a bit of an outline of the actual next 30 minutes or so. It's a background really as to who we are as an organisation. That's Greater Manchester Commissioning Support Unit, CSU. Some of the challenges that we faced, as I'm sure you can all appreciate, it wasn't completely straightforward. How essentially it can be done and some of these challenges can be overcome. I want to focus a little bit on ServiceNow itself as a sort of tool underpinning a lot of the work we did to help bring that all together, and then also an approach to the project, and then just summarising some of the results and benefits that we achieved. Okay, so on to a little bit about us, setting the context and background about the organisation. So Greater Manchester CSU, who are we? We are business support to the NHS. So what that means is we actually provide direct support services to the NHS, and that's listing there of all the different service areas that we provide. So you can see there, that's a lot of classic back office type functions that we actually do provide to a number of NHS organisations. We actually formed fairly recently, on the 1st of April 2013, so we are quite a young organisation, and essentially we were formed from creating a single shared service from the previous 10 organisations within Greater Manchester. And hopefully you can see there on the map the different areas for which we did have completely separate organisations operating in isolation from decades of legacy operating previously. So, a little bit more about the CSU. So we're a 50 million annual revenue business, and we're supporting the delivery of healthcare services to 2.7 million people, so that's the population of Greater Manchester, with an actual customer base. So the CSU's customer base itself is approximately 12,000 people. Okay, so on to our customers then. So this is how our customer base is actually split. So as you can see there, the vast majority of our customers are actually our GP practices. So we have approximately about 11,000 customers from the GP practices. And I've included just some photos there to sort of show how healthcare has kind of changed really over the last sort of 5 to 10 years, really around moving away from the previous doctors, surgery and old houses perhaps, and into some state-of-the-art modern healthcare centres really. So as I said, that's about 90% customer base in GP practice. The other split is approximately between the clinical commissioning groups that we have. So they are in effect like our healthcare managers and our contract holders, and then the people who actually decide on what healthcare services are provided to the population. And then also another 500 internal customers. So that's the business in effect. So that's IT, ourselves supporting the business. Okay, a little bit of focus here now on IT services ourselves. So essentially, we are the primary support department for all our customers. So that's for support and delivery. So we do have third-party suppliers, but all our customers contact us as the primary points of contact for anything that they need in terms of IT support or requests in terms of delivery. Now, a little bit about the customer base again, back to the sort of GP practices, and they do range from all sorts of different types of customer profiles, from GPs themselves, practice nurses, reception, admin staff, and healthcare managers. So I'm going to touch on the catalogue in a short while, but as you can imagine there is a vast different range of roles there, and therefore a vast range of IT systems that are requiring support. A number of safety critical systems that we actually support also. So, for example, within the GP practices, their clinical systems for patient records information is absolutely safety critical. So we obviously have to take that into consideration when we're building our IT service to make sure that we are at least able to support the business as we need to. Just the last point there really about the sort of size of IT services within the CSU. So IT actually accounts for 48% of the total business, which is £24 million annual revenue. Okay, so a little bit about this sort of legacy situation, so where we actually came from. So we had the 10 organisations which were all operating completely separate departments. So they actually had completely separate teams, management structures, and different systems. Now, this is a historical situation whereby they were actually born out of their own areas over the last, decades and decades, in fact, by actually merging support services. I think pretty much the first time that's been done in the NHS. So you're looking at obviously 60 years or so there in terms of doing this sort of kind of back office change exercise. We can list it there really in terms of different components or categories really around what was actually different across the teams. You can see there, looking at the different IT departments within each area, they all had different service hours, support channels, SLAs and service level targets, different processes, obviously support tools in there as well. So as I'm sure you can imagine, there was a lot of difference between each of the areas, which then also adds additional complexity. And just to give you an example there, we had actually 11 separate individual instances of 7 different supplier, if you like, service management systems or CMSs, all working different processes of maturity. Okay, so that's a little bit about the organisation, where we actually were, and this a little bit about actually what we were looking to support. So, excuse me. So, for the IT service catalogue from our customer receiving and our supported services, I just included there a little screenshot from a data collection exercise we undertook, which is basically looking at what we actually supported across all those 10 different areas. So as you can see there, there's a lot of different flavours of service we have out there. We have 81 service categories, but we have 434 different flavours, different actual sort of products, if you like, that we have to then support and fulfil requests against. So onto the task at hand. So I've just included here a little bit of information around what the actual mandate was, what the actual task at hand was. So we can see here, I've highlighted just a couple of areas on this to say, essentially we were asked to bring it together to a co-located, centralised location, and then also a move towards consolidation and standardisation. Now, the main drivers behind that was our IT strategy. So we said there we had to make significant cost savings, and essentially the way to do that was to co-locate, bring together, centralise, consolidate, and standardise, making ourselves more efficient and hopefully more effective as well. And in effect, doing more with less. As I'm sure you've all heard that term in the past, we seem to do quite a lot in the NHS, unfortunately, which makes our life quite difficult. So that was the task. I just displayed here a little bit about a sort of visual in terms of the service desk, really. 10 completely separate organisations with their own IT departments, all coming through multiple support channels to a single service desk, and then second line team level support beneath that. So that was our kind of vision, if you like, really, the task and the vision that we had in terms of how we needed to make it look in terms of a support model. So we started then forming an approach to the project. So how do we actually go from where we are, from the 10 separates, into achieving that task that I've just displayed, consolidating, bringing everybody together, and basically creating a single co-located service desk. So we started out at sort of mid to end February, in fact, on the journey, and we were spending a lot of time there really doing planning, analysis work, looking at exactly what was going to be involved in what we had to try and tackle in terms of challenges, any new systems to buy, how we're actually going to make this thing happen. We then split the actual implementation side of it down into 2 parts. So we had transition, which was essentially getting everybody co-located. So that was moving everybody to a single location by the end of July. And then the transformation, the third phase, was around actually reducing our headcount and making those efficiency savings that we need to do. Okay. So what we did is, within the project, we defined a number of success criteria to help us understand what success actually looks like. So obviously we had the task to say what we needed to actually do, but obviously to make sure that that was successful, we can't just go ahead and do it. We had to make sure that certain things were actually put in place, and we were still working to a really good level of service as we required. So for those 2 steps just covered there, we had transition, So we said obviously physical location is an absolute must. Customer satisfaction was very high in terms of being able to survey our customers and check that actually our performance on satisfaction hadn't decreased. And we also wanted to look to see if we can make a headway into standardizing our working practices. Then for transformation, we were looking at basically bringing that all together. So away from those 10 co-located teams to a smaller number of teams within a single standardized service desk. And what I mean by that essentially is all working to the same processes, the same tool sets in the same way. We were absolutely mandated, we had to reduce our headcounts. So from that as well, we said there we would have to get down to our required target operating model as part of the new restructuring exercise that we had to take to make the significant cost savings. So that was mandated, and we were also asked to obviously provide hopefully some really good value from a service desk perspective. So we didn't want it to just be like a log and flog type service desk. We wanted to actually generate some really good value from a first-time contact perspective. So our first-time fixed rate was one of the metrics, one of the sort of KPIs really that we wanted to really make sure we had up there. And then again, we actually not wanted just to sustain customer satisfaction. We wanted to actually improve our customers' perceived or actual levels of value from us. So again, we had to make sure that was one of the conditions within the project for success. Okay, so back into that first planning section that I covered about the analysis, really around all the different tools that we have and different departments that we have, different processes. That was quite a sizable piece of work, and we had to do this at a quite quick pace. So what we did is we went round to each of the teams within each of the 10 old organisations, and we did analysis. We did reviews on what their promises that they made, the SLAs, and their internal service specifications. We looked at different IT tools that they have, different processes, all those different sort of areas really in terms of what was required to be changed to actually bring them into the new area. So that was a little bit like a sort of gap analysis, if you like, looking at all the different changes, all different differences, and then what would actually be required in terms of bringing them together. So the more different they were, essentially, the more harder you could say the exercise was going to be. And what we found was that essentially most areas were very different. So that sort of informed us we had to be quite clear in our decision-making ability. We had to obviously understand we had to standardize quite ruthlessly, in effect, and make some really good decisions around trying to get everybody on the same platforms, on the same SLAs, and we had to do that at quite quick pace. So we can see here we've got a number of areas that we had to actually make decisions against, and essentially said we, in effect, in most cases, in other cases, started from scratch. So, for example, on our processes, you can see that incident request change config. What we did is we actually went right back to the board and we started again from scratch, based on the fact we were starting into a brand new organisation, and we had to essentially make sure that these processes were fit for purpose. We actually instead just designed them from a piece of paper, in effect. Lots of other areas we had to consider. We had to consider SLAs, legacy commitments, promises we made previously. The people was a significant aspect in terms of hopefully wanting to make them believe in what we're doing and really want them to understand why we're doing it. We did a lot of work around people and culture side of things, having presentation sessions with the people, making sure we were there for them, making sure that they could talk to us, we could listen to them, we could then hopefully alleviate any of the issues and concerns that they have around this. We actually brought them around for some visiting sessions as well in the new environment. So we're going to basically, we built a brand new floor within the building that we decided to go for, and we actually had the people visiting the floor, going through all the different sort of layouts and setups that we'd have, giving a bit of a view as to what it was going to be. And this is essentially a view on a summary sheet that's used to have a look at all those different components or characteristics around the merger and what we'd actually have to consider in terms of the impact analysis and what kind of effect that would then have. Any options papers around making decisions or choices were also included as part of that overall summary. So we understood exactly what it was we're implementing. So that was in effect us designing our own service specification for the IT service desk. Now, there was lots of different decisions we had to make, and it wasn't easy. For example, access channels there you can see towards the bottom of that sheet. For instance, we decided that to make sure we could provide as an effective level of support as possible, not to take in email. So it was purely phone calls or web self-service that we decided to go for. And obviously there was some rationale behind that, and that was that we just couldn't allow for people emailing without actually understanding the situation we're asking them for. So a data set was required from the user, hence I wanted to make sure we push people down the web self-service channel. Okay, so into the planning and setup phase again still. As part of that exercise, we had to look at consolidating our tool sets. So we realized to get these benefits, standardization, consolidation, we had to move towards a single tool set that we'd be able to use within the new organization that was merged. So we looked at our IT service management tool. We ran a procurement exercise for that. And then we also ran one for the remote access tool procurement exercise also. And they were regarded to us as being our two main really critical support tools that we needed to get in place that were going to be fit for purpose for the new organization. So just give a little bit of insight really and to focus on the service management tool. The business case itself, which we put together, really focused around what the tool needed to actually try and achieve and how encompassing the tool would be. So we wanted to make it almost like an enterprise resource planning ERP type tool. Obviously, it had to be very focused around service management, but we also wanted it to be available for the other departments within the organization, such like finance, HR, business intelligence, information governance, complaints, comms teams, all of the departments that have already expressed an interest in working across a single platform. And we can see benefits from that in terms of being able to actually have standardized working across the organization, standardized reporting across the organization. And so essentially, it was something that was really considered when we did this piece of work. So as part of the government procurement exercise, we had to go out to tender. We evaluated all the shortlisted candidates, and the evaluation criteria that we had was, I like to think, fairly robust. It was actually categorized down to about 25 different categories, and you can see that just giving a bit of a summary really as to different sub-category criteria that we had. So against each of those sub-criteria, we had 193 questions in total across those 25 different sections. And there were questions sort of asking around different, customizability of the tool, how the reporting aspects of it, and can we do that ourselves? It was really trying to get underneath the skin of the tool and ask the suppliers about that. And we actually had a full 2-day session with the shortlisted candidates, really making sure we spent a lot of time looking at the tool, getting underneath the skin of the tool and understanding how it's going to work, and also what kind of support we would have as an organization as we're implementing it and then continuing and support its configuration and development. So the successful product we had was ServiceNow, and with the partner of choice is partners in IT. Now, what we decided to do is basically fairly early on, so back into the sort of February, maybe even January time, back in the project timeline, we actually really started to look at getting in the processes into the tool and getting it built and ready before we started that transition work of bringing in each of the organizations organizations. So partners in IT would come along, and we would have day sessions looking at the processes and looking to configure ServiceNow so it underpins our requirements. It was obviously a really, really excellent session there because it basically enabled us doing it before all the mergers, before we actually transitioned and transformed. It gave us that time we needed to actually understand, think about the tool, start sort of, do some sort of testing ourselves around, how it's going to work once we actually get to that end vision place that we needed to be. The web portal for us was something that was really important because we wanted to make sure that it was going to basically be something we could really almost sell through. So we wanted to basically use like a PR exercise almost, whereby we would actually have people going on, hopefully on almost like a daily basis, seeing what's new, what's come up now, what else do we have from the CSU's perspective for us to be able to buy from us. The reporting side of things as well was very, very useful because going back to the previous setup of the 10 all working separately, some teams had 0 reports. They didn't report on anything whatsoever. Some had fairly mature reporting in place, and so we had to bring it up to at very least the same standard of the best of each of those 10 that they had in place. So we set about basically putting in place a customer service report and also internal IT operation reports. And they were actually both on the portal as well, selectable by anybody within the business. So senior management could go into then and view the customer reports and internal operation reports. And then also, again, customer surveys, going back to our success criteria, they were fairly key in terms of actually making sure they were in place, ready to be used right from the off. Okay. So this is a bit of a view of the actual tool itself and how we kind of got the look and feel for it set up. So that's just the console view of open service calls. And we found the feedback from all our colleagues here from the service desk team fairly positive. They were very happy about the tool. They liked look and feel. And the fact that it was obviously web accessible was a big bonus because we actually allowed the teams, when they were still in their old areas, to be able to go onto the web and view it underneath a test instance and get a feel for the tool. So that, again, a bit of the culture side of things, I think it really kind of helped in terms of ensuring that they're in a position to kind of feel good about what differences are coming up, what sort of changes they're going to be experiencing, and they can actually get actively involved in that. We also asked a number of them to actually help us with the testing, again, hopefully by engaging them. They felt empowered and they felt good about all the changes we were actually bringing about. And this is the web self-service portal. And you can see here we've gone for the sort of panel design, and we wanted to make it as simple to use as possible. And we wanted to use terminology, something broken, order something that was really, really, really clear, essentially, to our customers and to our internal users of the service. And you can see there the reporting section we've had set up for different categories, and this is a filtered view. So, for example, I can see all the options on here. Our customers can see then a subset of those, a sort of a lesser number of options on there, depending on what their access permissions are. Okay, so just to talk about the actual phase 2. So this is a bit where we actually started bringing the teams in to physically locate together. We had the sort of dates there where we sort of did a lot of planning beforehand, and then we in effect compressed all the moves into a single month to meet the end of July deadline. So what we had here is basically bringing together more than one team on a single day, but doing them in batches. So doing them over a week at a time, but bringing in more than one. So essentially what we had there is all the technical enablers, all the testing we had to do. We could bring in one person from each team. They come in the day before, do all the testing that needs to have in place, and then essentially we would have a sort of, if you like, big bang per area go live, where we'd bring in on a rota somebody in very early, say, I don't know, 7 o'clock it was, I think, and then somebody else coming in at, say, about 10 o'clock, and then the rest team then after that to make sure they had some computer service back at the old site, but then also coming into the new site as well, to have that sort of handover in effect across there. And this is a bit of a sort of insight really into different, or some of the components of our actual move. So we had to, for each area, agree all these different components, ensure they all set up already. The teams were happy with how it's going to work. For instance, so just take the legacy data transfer. The more thinking about the project and understanding what was going to go on, we realized and appreciated we would have a number of outstanding service calls on their old legacy help desk system, and then bring them across into the new environment that we're going to go onto ServiceNow. So that was basically a big bang crossover straight from the go live date onto ServiceNow. So we appreciated, we had to actually transfer some of the existing service calls. Some of the patches actually had over 800 outstanding service calls that we had to bring across. So we had to essentially do a data extract the night before, and then a data import in the morning before service hours opened. So that was just some of the sort of insights really in terms of the different things we had to consider and do as part of the move to bring them onto it. So essentially some of the challenges we had. So again, around the technical enablers, making sure the telephony was set up, making sure ServiceNow access rights were granted, the colleagues were able to actually access and get onto the correct areas, data import around all different organizations we had on there across different organizations and locations. Business continuity was a significant aspect we had to be mindful of. By bringing everybody together into a single physical location from a previous 10 separate physically located areas, we had to think about what happened if the site goes down, what happened if we lose power, for example. So we had to really make sure we had some sort of robust business continuity arrangements in place should anything happen to this physical location. Okay. So just to summarize the phase 2 transition aspect, it was a success. So we managed to actually do what we set out to actually do. We had everybody moved over onto ServiceNow. We had all the tickets moved across as well, and essentially all the team working to a standardized practices in parts, at least, on a brand new tool set. Okay, so on to phase 3, transformation. So the task ahead still was going away from having the 10 separate teams down to a lesser number of teams, reducing the headcount significantly, looking at the different levels of performance, such as first-time fixed rates, and then also looking at standardizing our working practices in full, i.e. being a single service desk, moving away from having everybody working in different ways, different working practices, procedures, and processes. So this is our vision in terms of transformation, really, in terms of what we want to try and actually get out of this. So we want to be a guaranteed contact point for customers. We wanted to move towards being a highly skilled service desk, which meant a high first-time fixed rates. We actually managed to achieve a single tool set, but some of the teams were reliant on some of the old tools that they had in place. I wanted to try and achieve call ownership in terms of actually being incident managers within the service desk, in effect. So how we tackled this was we did more analysis on the teams, which is a little bit easier as well, seeing they're all physically located in the building. And we appreciated here that the vast majority of benefits was going to be brought about by the actual staff capability in terms of upskilling and also cross-skilling as well. So that can be the most significant aspect in terms of what we could do there. in terms of the actual organisation and capacity aspect, we looked at that to sort of say, okay, well, what are the different processes, what different team support channels we have in place, where can we in effect move things around in terms of a support model. So we saw some benefits around some of those areas, IT tools and systems, again, and looking at essentially ways of working, processes and performance management. So I'll get some really good reporting in place to understand what was going on. Now, from looking at that, from analysis, we're working out, okay, go from the 10 teams, then into the 6, and then into 3, and then take it from there, essentially. So we didn't want to necessarily go down to a single team for the whole of Greater Manchester. We wanted to have, teams within the service desk. There's benefits around that in terms of resilience, continuity, having rotors in place. Plus, going back to the service catalogue we showed before, having those 434 different types of flavors of services that we are supporting. That's quite a lot for every single person on the service desk to actually cover. So, in terms of that being our kind of insights and our approach, we split up the actual physical area of Greater Manchester into 3 zones, as we call them. So we have northwest, southeast, and central. Now, in terms of analysis against this, it was very, very similar customer numbers, very, very similar service calls against each, and very, very similar numbers of assets as well. So we were fairly happy with going to this kind of a separation in terms of actually how do we look to tackle the whole of Greater Manchester in terms of bringing down and centralising. So on to a bit more detail on our approach. So we can see there the first level of integration was moving from those 10 different areas, and step 1 would move them into 6 teams in October. So that was actually starting to have teams working together, working across the desks to actually cross-skill, and also conducting some training programs to actually upskill individuals as well. And then we did some more analysis against that, and then in December we actually moved to this medium integration, which is basically going from those 6 down to 3, and again a very similar sort of situation, looking at our training needs, looking at cross-skilling and upskilling again. So just to give you a bit of a summary around the actual training needs analysis, this is kind of like a fairly common tool people might use, which looks at actually different teams against different sort of areas, and obviously that was like a summarized view. We had a detailed view beneath each of different localities, different areas, looking at actually different services. So we highlighted the sort of top 20 or 30 main services that we get the most calls against, 80% of calls against, and they were the ones we focused on in terms of cross-skilling and upskilling our team against. So, phase 3 transformation. Okay, by the end of December, we actually moved across into the 3 teams from having 10 separate physically located service desks. We actually surpassed, in effect, our whole time equivalent target by actually reducing down to 16. 16 was the target operating model, but we actually had more staff in place, so the reduction was more significant than we actually anticipated originally, and that obviously meant the pay cost reduction was significant also. Our first-time fixed rate was actually significantly higher than we anticipated, so we were hitting immediately from January onwards greater than 70%, and we're actually into the 80s now, which is absolutely fantastic news. Our customers are very, very happy with our service, and just to give it a feel of sort of volume that we're actually doing now at the minute. So we're doing 8,000 contacts per month, and that's split between 6,000 on the phone and 2,000 by the web. In terms of where we are now, what we are doing is we are actually partway through implementing field service management. And what that means essentially is engineer, job, and kit dispatch scheduling. So the service desk receive a job, they can't do a first-time fix on it there and then, so they actually dispatch that call to an engineer and actually be able to agree a window with the customer and who it's going to be, and then actually log the job with the customer there and then and the engineer there and then. the engineer will receive the appointment and essentially have it in their diary as a scheduled job to then go and conduct any kit that's then required. We are dispatching it from a central warehouse location by a courier, so that arrives on site before the scheduled engineer time. We're also looking at knowledge management as well, again, in terms of actually really supporting across the whole of IT operations to make sure knowledge is shared in terms of resilience and in terms of actually upskilling and cross-skilling our teams. Okay, so any questions, please feel free. Our details are there. Should you have any questions whatsoever, I'd like to feel free to contact me. My email address is the best way to get hold of me, and that is displayed on the presentation on the slide there. Thank you very much.
This is Paul Jenkins from Partners IT. Thank you, Tony, for your efforts with that presentation and, of course, for the relationship over the last year. I just invite any of the audience to post questions either directly to Tony or through myself. We'll hang on for a few minutes now because some questions are coming through the chat facility. But thank you all for attending, and hopefully we'll have an opportunity to catch up with you over the course of the next few months. Tony, if you could hang on for 5 minutes while we just wait to see if any other questions come through that platform.
Mm-hmm.
Okay, we're just collecting some of the questions through. Tony, if I might put a couple of these at you, and then Justin, who happens to be one of the consultants that worked on the project. Justin, I'll pose a couple of the questions in your direction.
Okay.
First question up. Given that the staff reduction was one of the stated objectives, how did you keep morale up through the project? Okay. Yeah. Okay. So absolutely, it was a challenge, a significant challenge. What we actually had was a change program overarching all this work, and that change program was around organisationally restructuring. Now, that was moving away essentially from the kind of headcount volumes that we've had previously, and essentially cutting them down significantly. So a lot of the people knew the task ahead was happening anyway. So essentially the project was sort of operating within that overall program in terms of the headcount reduction. Keeping morale high, we were helped by having a high number of temporary agency contractor staff who are working across the service desks already. So that was one side to it in terms of being a benefit of not having to let any permanent substantive employees go. But on the flip side to that, we had to manage knowledge. So we had to make sure people as agency staff didn't see us coming up ahead and just walk out the door. And what I'm pleased to say is actually, until fairly recently, we still have a number of the agency contractors working with us because we treat the agency contractors exactly the same as we do our permanent staff. Everyone's here to do a job, and we do listen to everybody and respect everybody. And when some of the agency staff are actually moving across into the CSU physically, they had issues, the typical kind of stuff around facilities, around where do I park and what happens here, what happens there. And we absolutely made sure we answered everyone's issues, everyone's queries. So by being there for them, I think was a big help in terms of understanding their situation. In a related fashion, Tony, a question around how the IT staff reacted to the cultural change.
Okay, yeah, sure. So we ran a series of sort of like welcome events, sessions. We spoke to them directly, went out to see them, brought them into the new building, and showed them around the office as well. And absolutely, I mean, the people are, from my perspective, the most important component or part of the business. And we really wanted to make sure everyone was happy and they were understanding what was going to go and happen as part of that. I mean, again, in some respects, it was against the backdrop of the whole of the business being formed, the CSU. So the cultural changes, some were brought about by that, which we obviously helped because there was a big drive in terms of the new identity of the organisation. So that was a bit of a bonus, but we wanted to try and create an identity within IT and the service desk as well.
If I might just join a couple of questions together. Question around the take-up of self-service and whether or not you removed email contact in part or entirely from the community. Okay, yeah, sure. So the email contact was actually switched off when each of the 10 organizations moved across physically into the one location. So that was underneath the transition phase. So basically our support channels changed in effect overnight then. So we sent out some messages to all the customers, and we informed them that there were some changes. Here's your new phone number, for example. Here's your new web self-service. Email is going to be shut off, and any of the email addresses would put out of offices on to make sure that things weren't being sent in and then the customer thinking they've been received. So yeah, absolutely. In terms of the web self-service, the take-up, I think was about 30% of our total customer base now, against a customer base of about 12,000. I think that's fairly significant and fairly good going, actually. So yeah, I mean, obviously understand by cutting off email, web self-service might increase, but to that extent, we were really quite impressed pleasantly from that.
And a question I think many people will be interested in, what do you ascribe the step up in first-time fix rates to? Because they are quite significant.
Yeah, sure. I mean, it's, essentially, we've always tried to run, since we come into the CSU, a highly skilled service desk. We see it in that shift to the left diagram I presented earlier, display that really the earlier on within the sports teams, department, organisation, you can actually fulfil issues. The better it is for us, and the better it is for the customer. Now, I attribute that mainly to do with upskilling and cross-skilling. Like I said, we spent a lot of time making sure the people were learning, understanding the issues. I talked at the end about knowledge base. We do have some good knowledge articles in place also. We don't have them all in a managed, processed way quite yet. We're very, very close to getting that done. But again, knowledge articles were very key to that as well.
And what approach did you take for change management for users, IT, some of the other stakeholders? Okay.
I mean, in terms of our approach, to start off, in terms of the sort of previous setup that we had, the previous 10 organisations, change management was very, very light, you could say, to be fair. Some organisations didn't really do change management whatsoever. So what we did is, as each area came in, we actually had an internal process in place, so anything that couldn't be dealt with by a request fulfillment, we would pass over to the change manager, and the change manager would essentially then, based on all the changes that were happening around all the different infrastructure changes, understand, analyse what was going to be done apart from the area as part of that. So it was done on a locality by locality or area by area basis, and essentially we had ServiceNow built up for change management, so everything was managed, tracked, and controlled via that. The customer put in their service request into ServiceNow and track progress of, in effect, their RFC, because their request coming in became their RFC, their request for change, and they would track progress of the change via the web portal as part of their RFC.
And several people have asked the question, how many service desk staff have you ended up with following the implementation of the platform? Against those numbers, so I think we're 8,000 contacts a month, and 6,000 of those are still on the phone.
Yeah, that's exactly right. Yeah, and we're down to our 16 headcounts on the service desk. Yeah, that's right.
And question around the historical data.
Mm-hmm.
In terms of migrating from the previous platforms, how did you cut the data over, and also some of the reporting data?
Okay. Yeah, sure. So the reports were very, very minimal in the old areas, in effect. So we said to customers, we're going to be reporting as of when you come across. So each of those dates we gave you in July for each of the customers. That's from that point we'll start reporting to you as us being now in effect new service provider. In terms of the data transfer coming across, we actually did an extract from their previous old help desk system into I think it was a CSV. Justin, you may know a little bit more detail than I do on this, but I think it's to a CSV. And then the CSV would be then imported before service hours opened the next morning into ServiceNow, so that when the desk staff came in, they would have all their calls as was on the new system as they have on the old system the previous day.
And certainly it's one of the things that when we look at transitioning data, it's always one of the biggest challenges, taking data out of an old legacy system into a brand new system. And because there was an absolute necessity to say that everyone had moved from a location and those old legacy systems would not be available, then there was really no option but to take that data over so it was available for those teams to still be able to work on. It's one of the things that's quite challenging in normal circumstances, and this was still challenging, but we were able to migrate the data successfully.
Thanks, Justin. And finally, Tony, could you just describe how long the planning phase took? I think it was covered briefly by one of the slides, but just to reiterate.
No, that's absolutely fine. I've tried to sort of simplify it on the slides because I think it was about a 600-line, if not more, actually, Microsoft project plan. So it has to be simplified. Essentially, the core of our planning activities did take place towards the end, mid to end of February, right the way through. Yes, towards the end of March, but also into sort of June. March, April, May, as well as June. So, essentially, the core analysis, the core reviewing the old areas happened in that first month and a half or so. A lot of sort of then actually getting the things in place in terms of readiness and planning, that then happened in sort of, the 3 or so months preceding the July moves. So, you could actually put it in sort of, 4 phases, I guess, if you wanted to do so. But it's, it was really, a case of having the analysis, then the technical enablers and readiness, and then transition and then transformation. Hopefully that I can cover that.
Okay, thank you. I think we have some other questions which are slightly more sensitive and perhaps best answered directly, and we're coming up to the top of the hour that we had allocated. So I'll thank you all for attending, and we'll come back to you with a copy of the slides or a link to a copy of the slides. And for those questions that we didn't get around to, my apologies, but we will respond over the course of the next day or so. So thank you, Tony, again, and thank you to all the attendees.